And now, feature presentation.
Ronald McDonald House is really a magical place to witness. I think once you walk through the doors, you can immediately feel the warmth and the hospitality and just the network of support inside our walls of people from all walks of life who have come together to care for families during their most difficult times. Every day I see volunteers smiling, welcoming families, asking them how their child's doing, literally giving them a shoulder to cry on. And I think Ronald McDonald House's mission is something that everyone can relate to. If you've had a sick child, you know how stressful that can be. If your children are healthy, you're just grateful for their health. And I think our volunteers and our staff and our donors all just really appreciate what this house does to care for families and carry them through such difficult times. The children whose families stay here are critically ill. These are kids who have cancer, who've had bone marrow transplants, liver transplants, serious trauma and injury. It's well beyond the common cold. I mean, these are really sick kids. But I always tell people that it's a hopeful house. It's not, people say to me, isn't it depressing to work with so many sick kids? And I always say, no, actually it's full of hope, because most of these kids, as sick as they are, probably about 95% of them get better and go home. And we rejoice every single time a family gets to leave. And we say, you know, it's been great knowing you and we hope we never see you again, because that means your child's doing well, and that's all we wish for.
During one of our visits to the Ronald McDonald House, we met an extraordinary family from the island of St. Lucia in the Caribbean. Their son had recently undergone successful, life-changing surgery at Children's Hospital Medical Center.
This whole journey, I think, could not have been possible without the help of both entities, without the hospital and without Ronald McDonald, because they merged together in helping both the social needs as well as medical needs of the patient and their parents. And I don't know what else I can say, but I want to thank everybody at the Ronald McDonald House at Cincinnati, and also the doctors at the hospital, Dr. Pena and his staff, for helping us with our journey and with Liam's health, medical problems.
Coming into McDonald's house, it was, I mean, I didn't expect the warmth, you know, and the community atmosphere that we received.
He comes back home, not his home, but he comes home to friends, toys, family, you know, hugs. And I think that is what makes Ronald McDonald House so special. That home away from home with a complete stranger just hugging you and saying, you know, you're going to be okay, and you're going to cry, and you might be crying and they will wipe the tears from the kids, you know. That is what makes it so special for me.
I'm home, away from home, you know. Everybody was nice, you know, you had access to all the different areas. You know, Liam was in a different world, because here he is, after struggling with his situation for so many years, finally got the opportunity to actually be around kids without being interrupted to go to the washroom, you know, to change, or somebody telling him stuff about how his scent, you know, and all the different rooms and departments of the house, reading all, you know, who's it donated from. Even that took me aback. And I'm thinking one time, you know, how could we, in some way or the other, you know, contribute or donate somehow? You know, we're going to leave knowing that we feel as if we owe. You know, we have to give back in some way or the other.
We always rejoice with families when their child gets better and gets to go home. But of course, the worst day imaginable here is when a child passes away. I'll always remember a little boy named Henry who was born here. His mother had a high-risk pregnancy, went into labor at our house, and delivered here on our family room couch with the help of the local firefighters and paramedics. And her little boy had a very serious heart condition and struggled, lived most of his 2 years in the hospital. He eventually had a heart transplant and passed away after the transplant. And our whole staff grieved with his mother because a lot of us were there when he was born. We knew Henry his whole life. And, but I think the one, if there is a good thing that came out of it, is that his mother and his family met so many amazing people here, other families who stayed here, and our staff, that to this day we still keep in touch. And she still draws strength from the families she met here. Ronald McDonald House is a happy memory for her. And she even said to me once, she said, you know, my pain is so much every day, but I would have never known my child if it hadn't been for Ronald McDonald House. We would have never had those 2 years together. My hope is that people in our community who are not familiar with Ronald McDonald House or who haven't seen it would just come see it. And I think once you walk through the doors, once you see the families and you see what goes on here, you'll want to find a way to get involved, whether it be through your time as a volunteer, through financial support, through providing meals and activities for the kids. There's just so many ways to help here. And so my hope would be that people would just come see what we do.